would like to offer my sincere congratulations and appreciation to the graduating class of 2021. You should be extremely proud of this accomplishment, especially given the remarkably difficult circumstances of the last year. Residency training is an arduous journey, but you made it through together and helped each other, as well as our patients, to deal with one of the worst health crises our planet has faced. I want to thank each of you for your service, your commitment to each other, and your dedication to providing the patients of our community with the best care possible, even in the most exceptional circumstances. I wish each of you the very best in your future careers.
Hello. What an exciting day. We are so proud of all of our graduates today. We know that you, as residents, you have had a tremendous experience at Prisma Health, and we are just couldn't be prouder of what you have really experienced and what you have learned while you were here, but more importantly, what you have contributed to Prisma Health. We are very proud to say that we have over 106 residents and fellows in our Upstate area. There's 115 in the Midlands, which gives us around 221 total graduates. And we couldn't be prouder of each and every one of you. We want you to be aware that we know that while you have trained here, you have practiced here, we know that you are going to go forward and do great things. We are so proud that we have been able to retain a number of you here in Prisma Health and in the state of South Carolina. And we also know that some of you are going off to fellowships, some are going off to other areas to practice, and we are so proud of you. And we know that you will take Prisma Health in your heart no matter where you go. We want you to know that Prisma Health, we are committed to creating a better state of health for South Carolina. And if we haven't learned anything else during this pandemic, we know that healthcare does not stop at the borders of the state. So while you are training at Prisma Health and experiencing your clinical learning throughout our system, we know that no matter where you go to practice, we hope your experience with us has been one that will take you far. I think you're also aware that at Prisma Health, we are a very unique academic health center. In other words, we are a health center that is led by the health system. We have academic partners, however, with Clemson University, Furman University, and University of South Carolina. And we know that some of you actually have graduated from our University of South Carolina medical schools. We're very proud of who we are as academics because everything we do is focused on the patient. So as we have worked with Clemson University in the nursing program, it's really about training and educating nurses who will be positioned to practice when they complete their training at the bedside. We're affiliated with two medical schools, both the USC School of Medicine here in Greenville and the USC School of Medicine here in Columbia. We have a strong pipeline program through our Medics Academy program, a number of allied health programs and advanced practice professionals. We're also very, as you well know as graduates, we know you've had a chance to experience the research we do here. And we know that you see research here at Prisma Health very different from traditional academic research because everything we do is studying what's going on with our patients. Thanks to each of you as you are planning for graduation, for everything you have done to contribute to our research enterprise. We also have over 8,000 students coming into our clinical learning environment annually. Many of you have touched these students, whether they're medical students or students coming in for other experiences. We know you have shared the clinical learning environment. And on this day, we are so proud to say with our GME program, we are 52 residency and fellowship programs strong. We're so proud of our training programs with over 600 residents and fellows in our system annually. So again, as you graduate, just know that you're leaving a system that you have others coming on behind you, and we're committed, Prisma Health is committed to our GME programs. As you think about Prisma Health academics, another takeaway for you, as I hope you have experienced, is we are laser focused on our workforce. We know you as residents, as you are graduating, no matter where you practice, you're going to contribute to the workforce. We are so proud to say that as we look at our workforce and our GME programs, we're intentionally trying to recruit you from day one. So if you're going away for a fellowship or going elsewhere to practice, we hope you'll remember your experience here at Prisma Health and one day come back here to practice. Prisma Health, I want you to remember, as we think about academics and our investment, our largest investment is in you. is in each of you as our residents and our fellows, because we recognize the opportunity we have to train and retain the best and the brightest. So thank you for being part of that pool of students to come through our training program this year and before. You are absolutely critical to Prisma Health's goal. If we're going to truly create a better state of health for South Carolina and beyond, we need you as residents. We need you now as you enter into the practices of Prisma Health across the state and beyond. We need you if we're going to create a better state of health for our patients and our communities. We know that as our graduates, you have received state-of-the-art training, and we are so proud of that. We know that you're ready to care for patients who are coming in with complex problems. We know that you are ready to be at the front line because as you have completed your training here, you've had a chance to not only be trained, but you've had a chance to practice alongside some of the best and the brightest. And we're proud of that because we're able to hire tremendous faculty and tremendous physicians across our system because you are part of our enterprise. And that whole idea of giving back to the next generation, I think, is what excites so many of our faculty and physicians across the system. So as residents, we know that you are heavily or have been heavily involved in our patient care here. We know you work 24/7, 365, and we appreciate that. We know that you have been involved as graduates with our quality and research projects across our system, all focused on patient care. We also know that our GME programs here at Prisma Health really positions us well as we continue to grow and look at the growth strategies for Prisma Health. We know our GME programs will continue to attract the best and the brightest among the residents, among faculty, and others who touch our clinical learning environment. So bottom line, Prisma Health invests in you because you make us better. We are so proud of each and every one of you. We wish you the very best, no matter where you're going to practice. We hope that your experience, your training, and your hands-on care with your patients have been stellar. And we hope that you will always keep Prisma Health in mind, no matter where you go to practice. Thank you.
Good afternoon. I'm Mark O'Hala, President and CEO of Prisma Health. On behalf of the Board of Directors and myself, we would like to offer all of you a sincere congratulations on this milestone accomplishment and exciting transition in your careers. Residency graduation is a remarkable achievement. In a year like no other, filled with stress, disruption, and uncertainty, you all have gone above the call of duty to meet the pandemic's many challenges. I hope this year reminded you why you decided to choose medicine. Responding to a crisis and ensuring a community's health needs are met is what we do. This is why we are here, and I know you will carry the learnings from this experience into your future careers. In an academic healthcare system in a normal year, residents serve as an indispensable resource to the entire team. During a pandemic, I especially want to recognize the remarkable strength of our house staff for their tireless support of our patients and team members. Prisma Health is proud to recognize the service, dedication, and growth of all of you. Thank you for your commitment to our patients, each other, and the communities we serve. As you close this chapter of your academic careers and transition into your new professions as fellows or physicians in a practice, we hope you will take with you the purpose to inspire health, serve with compassion, and be the difference. On this special day, we celebrate the graduate medical education class of 2021. The long hours have paid off. You've done a phenomenal job, and you should be incredibly proud of all you have achieved. Congratulations, and we wish you all the best of luck in your future endeavors.
Hello all. My name is Kyle Benda, and I am this year's Prisma Health Upstate House Staff Senate President. On behalf of all of the residents and fellows across our 3 campuses, I would like to wish the biggest of congratulations to all of the graduates of the class of 2021. As I reflect on my own residency experience, I could not be more proud to have grown both personally and professionally alongside each and every one of you. This last year has brought unprecedented challenges in an ever-changing medical landscape wrought with adversity and obstacles. With little time for preparation and even more limited information, we were challenged with the need for quick adaptation and expanded clinical roles as we faced the COVID-19 pandemic. Each of you were called to care for our patients compassionately, often in the face of uncertainty and scarce resources. Nevertheless, you are all successful. While I am confident that we would all have chosen to not have completed our residency and fellowship trainings during a global health crisis, our lives and careers have been forever changed. Using the education we've received alongside the care that we've learned to provide under these circumstances, we will unequivocally charge ahead and continue to positively impact the lives of those we've taken a sacred oath to serve. If I had to bet, I would say that most of us went into medicine in order to make a difference in the lives of those around us. This shared experience has seen that goal proudly fulfilled. As we go forth from our academic setting into our bright new careers, we will continue to innovate, lead, and impact the healthcare that stands before us. Our medicines, surgeries, and therapies will shine brightly because of the remarkable professionals that we've become over the past few years. I would like to take a moment to say thank you to the Prisma Health Office of Graduate Medical Education, our faculty members, and all of our hospital staff for providing us with a world-class training in an enriched academic environment. I would also like to say a big thank you to all of our fellow residents and fellows for supporting us in both good times and more challenging ones. To those that have paved the way for us and those that will continue on in our footsteps, we are grateful for you all. Congratulations again to the graduates of the Prisma Health GME Class of 2021. I wish you all the absolute best in your futures as we go forth and continue to heal our world. Thank you.
Good afternoon. My name is John Emerson, and along with Amanda Hartke, who is unable to join us today, we serve as the faculty advisors for the University of South Carolina School of Medicine Greenville's Gold Humanism Honor Society. The Gold Humanism Honor Society seeks to recognize individuals who are exemplars of humanistic patient care and who can serve as role models, mentors, and leaders in medicine. In addition to our student members, each year, the third-year medical students nominate residents for the Humanism and Excellence in Teaching Award. These residents from various specialties and levels of training are nominated based on their commitment to teaching and their compassionate treatment of families. Please join us in congratulating this year's graduates who were selected for induction into the Honor Society. Quinn Hunt, Medicine and Pediatrics, Kyle Benda, Family Medicine, Jason Hill, Obstetrics and Gynecology, and Eric Pauley, Medicine and Pediatrics. Finally, thank you to all of our residents for helping inspire the next generation of physicians with not only your clinical skills, but your empathy, your dedication, and your passion for teaching.
The Lily M. and G.D. Jackson Award is given annually to up to 3 first-year residents in the Upstate. This award was created by the Jackson family to honor outstanding first-year residents who provide compassionate clinical care with exceptional attention to the needs of the patients and families. These individuals are outstanding role models for their peers and have gone above and beyond the regular duties to make a difference to all they serve. This year's Jackson Award winners are Roy Anderson, Emergency Medicine; Casey McDonald, Family Medicine; Max Rosenthal, Internal Medicine.
The 2021 Darlene S. Norton Program Administrator Award recognizes program administrators whose leadership, teamwork, and professionalism embody excellence demonstrated through improving resident and fellowship training, inspiring their peers, and creating innovative processes for their programs. The nominees were evaluated on the following attributes and abilities: strives to portray an image of professionalism in all that they do, seeks ways to advance the role of the program administrator by taking the lead in special projects, serves as a role model to other program administrators and mentors new program administrators, contributes to providing an excellent training environment for the residents and/or fellows, acts as an integral part of the training program management team, goes above and beyond their responsibilities to selflessly serve their program leadership, residents, and/or fellows, and continues to provide excellent service to the program despite facing any adversities or challenges. For 2021, The Upstate has co-winners, June LaCroix, Family Medicine Residency Seneca, and Kelly De Silva, Meds Peds Residency Greenville.
Good afternoon. I am Desmond Kelly, the Chief Medical Research Officer at Prisma Health, and it is my honor to announce the winners of this year's Research Awards. This is at a time when the value of research is increasingly being recognized in supporting the purpose and the goals of Prisma Health as we are the difference and strive to improve the health of the population of South Carolina. The Research Award criteria are as follows. This is based on research submitted during the resident or faculty members' time at Prisma Health over the past 3 years, and the submissions are based on the following criteria: quality of the research project design, uniqueness of the topic and approach, potential of research project to contribute to advancing the field, the quality of conduct of the research project, and whether the project has been accepted for presentation or as a manuscript by competitive forums or peer-reviewed publications. On to our award winners. This year's Faculty Research Award winner is Dr. Jeremy Warren, and he wins this award for his work titled Safety and Efficacy of Synthetic Mesh for Ventral Hernia Repair in a Contaminated Field. Congratulations, Dr. Warren. The House Staff Research Award winner is Dr. Diana Peterman. Her work is titled Implementation of an Evidence-Based Protocol Significantly Reduces Opioid Prescribing After Ventral Hernia Repair. Congratulations, Dr. Peterman.
Emergency Medicine Residency. Salam Kwame Avatry. Brian Ethan Brown. Eric Burton. Ashley Davis. Thomas T.J. Davis. Connor Graham. Frederick T.J. Lynch. Cody Myers. Joseph Graham Roberts. Hannah Shaw. Family Medicine Residency. Kyle Robert Benda. Brittany Lamont Farrow. Sarah Michelle Guess. Kayla Ashlyn Hayward. Mark Anthony Michelucci. Brenlin Daniel Pitt. Primary Care Sports Medicine Fellowship. Yathavan Rajakulasingham. Callan Sowa. General Surgery Residency. Christopher Lee Cordis. Catherine Rainey Dean. Christine Lynn Griffin. Heather Ann Peluso. Robert Rhett Ryan. Summer Nicole Rochester. Ashley Nicole Vaughn. General Surgery Preliminary. Caitlin Rebecca Brown. Sarah Catherine Perigo. Adult Reconstruction Surgery Fellowship. Ronald Lee Newcomb. Colon and Rectal Surgery Fellowship. Andrew Davis Morris. Minimally Invasive Surgery Fellowship, Paul Stetschult. Jonah White. Surgery Critical Care Fellowship, David Carter. Vascular Surgery Fellowship, John Neal. Venous and Lymphatic Fellowship, Arian John Moshrif. Internal Medicine Residency, Corin Peter Agoras. Suzanne Gianna Bentley. Paige Catherine Ghanem. Humaira Sadar Hazari. Megan Elizabeth Hyde. Brendan John Kiefer. Marcus Duncan Mormon. William Joseph Sanders. Amber Danielle Stola. Daniel Jeffrey Temis. Marshayla Marie Temis. Bailey Elizabeth Wooten. Internal Medicine Pediatrics Residency, Justin Brantley Holliday. Quinn Douglas Hunt. Eric Madison Polly. Jackie Emmanuel Queen. Zachary Harrison Wood. Obstetrics and Gynecology Residency, Trace Christopher Dehan. Abigail Lynn Dishler. Jason Jeffrey Hill. Angela Marie Rohde. Kayla House Smith. Lindsay Elizabeth Eller-Young. Maternal Fetal Medicine Fellowship, Jill Hudgens Boland. Orthopedic Surgery Residency, William Allen Marshall. Shay Bilby Ray. Corey Daniel Smith. Orthopedic Sports Medicine Fellowship, Adam Hines. Christopher Roberts. Lucas Teskey. Sean Yeasel. Orthopedic Trauma Fellowship, Joseph Brock Waller. Pediatric Residency, Aubrey Trenton Fleming. Brittany Haley Gray. Jessica Erin Groot. Elvira Shredder Payne. Jennifer Lee Raffaelli. Rebecca Schur Rowland. Frederick John Scherstedt. Shane Megan Sundley. Paige Pasquale Thompson. Grace Kane Williams. Alex James Yu. Developmental Behavioral Pediatrics Fellowship, Megan Doyle. Psychiatry Residency, Alexandra Dodd, Brittany Johnson, Sunny Patel, Sarah Welchel. Child and Adolescent Psychiatry Fellowship, Jessica Grimes, Krishna Vijay Sarathi, John Merigliano. Pharmacy Residency, Adrian Eubanks Bundrick, Hannah Mae Christensen, Kristen C. Davis, Courtney Reddick, Clayton Auburn Rosebaum, Jenna Elizabeth Sorgenfrack.